Hi there, my name is Dr. Emma Svanberg and I'm a Perinatal Clinical Psychologist. So what that means is that I see parents and parents-to-be during pregnancy, around birth and in the first few years of becoming parents. I'm also a writer and a campaigner. At the moment I'm involved with the Make Birth Better campaign, which I'll tell you a little bit about towards the end of this video. But Mums Magazine have asked me to talk to you today about birth trauma. So I'll be doing that, but if you have anything else that you'd like me to discuss or you'd like to ask any questions about what you've heard today, then do feel free to get in touch. All of my details will be at the end of this video. So what is birth trauma and who does it affect? Well, depending on what study you look at, we know that birth trauma affects about 1 to 3% of women every year. That's throughout Europe. Now, those are the women who are affected by full-blown post-traumatic stress disorder, so the women who would meet a diagnostic criteria. We know that there are loads of other women who may not meet the diagnostic criteria for full-blown PTSD, but who are left really struggling with some of the symptoms of trauma, but without actually meeting that criteria. Even if 1 to 3% doesn't sound like an awful lot, when you look at the amount of people who give birth every year, actually that is affecting about 100,000 women every year throughout Europe. And when you ask women if they feel that they've had a difficult or traumatic birth, actually those figures are more like 30%. So that is a third of women after birth who are left feeling that they are really suffering and struggling with symptoms of trauma after their birth. And that's not to mention all of the partners who might also be affected by witnessing and being present at a traumatic birth. We also know, we're also talking a little bit more about how traumatic and difficult births can affect staff too. So that is a really wide range of people who are affected by traumatic births every year throughout Europe. And what is PTSD? Well, recent diagnostic criteria has defined a traumatic stressor, so the kind of event that might lead you to get PTSD, as somebody either witnessing or experiencing death, a fear of death, or serious injury to themselves or somebody else. So in this case, that would often be the baby. What's really worth stating very clearly, though, is that it doesn't really matter if somebody else thinks that your birth looked traumatic. It's much more about your subjective experience of your birth. To somebody else, your birth might have looked textbook straightforward, but actually, if at some point you felt that you were really in fear of your own life, you felt very unsafe, or you were worried about your baby's life or your baby's safety, actually that would increase your likelihood of being left feeling traumatised by your birth. Equally, people can go through what look from the outside as being very traumatic birth experiences, but come out of them with no traumatic symptoms at all. So birth trauma is an entirely subjective experience. What that means is that if somebody else says to you, well, but look, your birth didn't go that badly, and the classic thing, but you've got a healthy baby out of it, you both came out of it okay, that doesn't mean that you should be feeling okay. And how do you know if you're suffering from birth trauma or PTSD after birth? Well, to meet a diagnosis, we'd be looking for 4 main symptoms. Number 1 is called re-experiencing. So that might be things like flashbacks, where you really feel like you're back in the hospital again, you really feel like you're going through your birth experience again. You might have nightmares about your birth, but also you might feel the need to keep talking about it over and over again in a way that doesn't feel particularly productive. So that's symptom number 1. The second symptom is avoidance, and just as it sounds, that means avoiding anything that reminds you of your birth experience. So for a lot of people that might mean avoiding walking past the hospital in which you gave birth. It might also mean avoiding midwife appointments or doctor's appointments, avoiding talking about your birth ever at all to anybody. To some people it also extends to the relationship with your baby, so your baby can kind of come to represent the birth itself, and sometimes even looking at the baby can bring back some really difficult memories. So for a lot of people, they talk about finding it really difficult to be left on their own in a room with a baby and have difficulties bonding with their baby. So it just goes to show actually how much of an impact a difficult birth can have. The third symptom is what we call hyperarousal. So what that means is that you are just on high alert all the time. And it makes a lot of sense that you would be like that. All of a sudden, you've had an experience that has made you feel like the world is not such a safe place after all. So you're constantly on red alert, looking out for other signs of risk or any kind of a lack of safety. And again, of course, that extends to your baby too. So you might notice that you are feeling very overprotective of your baby, or feeling that your baby is at risk as well as yourself. And last of all, you might notice that your way of thinking and your way of feeling has changed a bit too. So that might mean that you feel a bit foggy in your head, you can't quite hold a thought in the way that you would before, or you might notice that your mood is a lot flatter than usual. And as you can see from those criteria, it's actually really hard to know if you or if somebody else is suffering from post-traumatic stress disorder after birth, or even just symptoms of trauma after birth, because there's so much overlap between those kind of symptoms and the sort of things that actually most of us experience when we've got a new baby. So feeling a bit foggy-headed and you can't hold a thought in your head, well, yeah, most new parents experience that at some point. Or even feeling hypervigilant, like you're looking for signs of danger everywhere. Well, yeah, again, about half of new parents experience that without ever having been through a difficult birth anyway. So as you can see, it's really difficult to spot. Added to that, actually, is that a lot of people don't know very much about birth trauma. So a lot of women get misdiagnosed with postnatal depression. And for their partners too, actually a lot of partners aren't asked about their birth experience and how they felt about their partner's birth, which again makes things that little bit more complicated. So what you need to do is really think very carefully about whether you feel that you've been more affected by your birth than you thought you would. And actually, it doesn't really matter if you meet the criteria for a diagnosis of post-traumatic stress disorder. If your birth experience is affecting your day-to-day functioning more than you think it should, then it's absolutely worth talking to somebody about it. Or there's also other resources that are available to you to help you recover from a really difficult experience. So the first port of call would be just to think about whether you're more affected than you thought you would be by your birth. It might be worth talking to somebody that you trust, like a partner or a friend or a parent, about whether they've also noticed any changes in you. But if it's something that you feel like is on your mind much more than you thought it would be and it's affecting you in a negative way, then do think about going to talk to your GP about it, or going to speak to a health visitor or a midwife. There are also talking therapy services locally that you might be able to refer yourself to. Unfortunately, what we know is that sometimes it can be really hard to access help, even if you feel like you have been affected by a difficult birth. That might be because actually there aren't any services available near you, or it might be that you really don't want to go back into the NHS to speak to somebody about your experience. It might also be that you just haven't found anyone that you feel really fits with you. And that is why I created a website called Make Birth Better. And together with Dr. Rebecca Moore, who's a perinatal psychiatrist, we've recently created the Make Birth Better network. And we'll be working and campaigning and trying to make some changes to maternity services to really try and prevent these kind of traumas from happening. You can find out more by going to www.makebirthbetter.org. And please feel free to check out the resources page on there. There's a whole section about getting help, where you'll find lots of information about organisations that you might find useful. I hope you found all that helpful, and please do feel free to get in touch if you'd like to know any more. Bye for now.